Hi, this is Dr. Martorell. I will be discussing the topic of fatty liver, non-alcoholic fatty liver disease, or MASH, which is metabolic dysfunction associated steatotic liver disease, or MASLD. MASLD is a condition in which fat builds up in the liver due to metabolic stress from excess weight, high blood pressure, high cholesterol, high blood sugar. It used to be known as NAFLD or non-alcoholic fatty liver disease. When the liver has fat buildup and is inflamed, it is called metabolic dysfunction associated steatohepatitis or MASH, which used to be NASH or non-alcoholic steatohepatitis. Causes of MASH include metabolic dysfunction, and this is seen in people with certain medical histories such as insulin-dependent diabetes, insulin resistance, or pre-diabetes, high blood pressure, high cholesterol, obesity. The combination of these disorders is metabolic syndrome. Most people with MASH have excess body weight or obesity, hyperlipidemia. Some people with MASH have hyperlipidemia, high blood triglycerides, and or high blood cholesterol. Insulin resistance refers to a state in which the body does not respond adequately to insulin. People with insulin resistance have prediabetes or type 2 diabetes. Most people with MASH have no symptoms. Sometimes people may have symptoms like fatigue, general feeling of being unwell, discomfort in the right abdomen. MASH may be discovered during routine blood work. There are some other testing that could be helpful for the diagnosis to include an ultrasound, an MRI, and it will show accumulation of fat in the liver. The person could also get a biopsy. The levels of ALT and AST, which are liver inflammation markers or liver function markers, may be elevated. Sometimes the alkaline phosphatase is elevated as well. People should be tested for hepatitis C, hepatitis B, and other conditions. Some testing should be done if cirrhosis or liver cancer or fibrosis is suspected. For example, transient elastography can also be used to help with diagnosis. Treatment of MASH includes or focuses on weight loss and also controlling the other medical conditions that may contribute, such as diabetes, obesity, high cholesterol. People should get vaccinated to protect against hepatitis A and B. They should be on lipid-lowering agents. Alcohol needs to be avoided. Alcohol can make the liver get worse. Losing weight can help to reverse MASH and improve the metabolic function, such as cholesterol and the blood sugar. Weight loss should be gradual, about 1 to 2 pounds per week. A nutritionist could be helpful. Treatment of insulin resistance is available. Treatment for diabetes when needed. Vitamin E for people with MASH who do not have diabetes. Vitamin E has been shown to reduce some levels of liver damage that occurs as part of MASH. Do not use vitamin E unless it is reviewed or discussed with the provider. Drug treatments may include resmetirom. MASH is typically chronic, lifelong. It is difficult to predict the progression, but again, weight loss can significantly improve the symptoms or reverse symptoms. Some people, MASH can get worse over time. The most serious complication is cirrhosis of the liver, cancer, and death. Cirrhosis is significant liver scar. A person with cirrhosis may not have symptoms. However, some people eventually will develop symptoms of cirrhosis, which may include liver failure, liver decompensation, death. Metabolic syndrome puts the person at higher risk of cardiac disease. I hope this information was helpful. Please like my social media pages. Take care.